In this video, I'd like to talk about type 3 hypersensitivity disease. Type 3 hypersensitivity disease is a type of hypersensitive reaction classified into 4 categories, characterized by tissue damage caused by immune complexes, which are formed through the binding of soluble antigens to IgG or IgM antibodies. In skin reactions, inflammatory responses such as erythema and edema are observed. Examples of diseases associated with type 3 hypersensitivity include systemic lupus erythematosus, SLE, serum sickness, rheumatoid arthritis, RA, and glomerulonephritis. Let's examine the mechanism of type 3 hypersensitivity using SLE as an example. Damaged cells release DNA and nuclear proteins. Normally, these are not recognized as antigens due to immune tolerance. However, if immune tolerance fails for some reason, B cells present these molecules as antigens. When helper T cells interact with these B cells and activate them, the B cells produce IgG antibodies. These antibodies bind to the self-antigens, forming immune complexes. As large quantities of immune complexes are formed, they begin to deposit on the basement membranes of blood vessel walls. This activates the complement system. Specifically, components C3A, C4A, and C5A exhibit anaphylatoxin activity, increasing vascular permeability. This increased permeability leads to the development of edema. These complement components also act as chemokines, a type of cytokine. This function attracts neutrophils and other immune cells to the site of deposition. Neutrophils attempt to phagocytose the deposited immune complexes, but fail. As a result, they undergo degranulation, releasing lysosomal enzymes and reactive oxygen species. This release causes inflammation and tissue necrosis. The necrosis leads to the release of DNA self-antigens, which perpetuates the cycle.